So today we're just going to be doing an oral speech mechanism revision. So I just want you to sign your permission to get tested. And I need you to put your name here. And then your signature right there. And today's date. 4/25/2024. Alright, so today we're going to be doing an oral speech mechanism revision. For that, we're going to need some Germ-X, gloves, a tongue depressor, a flashlight, a mirror, typically smaller than this, and our little sheet and a pen. So I'm gonna start by cleaning my hands, making sure my hands are clean. After that, you're gonna make sure you put some gloves on because we might touch the patient's face. Now we're all ready. And I'm gonna ask you for your name, your age. Okay. And how old are you?
27.
So I'm gonna start by checking your lips. So I'm just gonna take a look at your lips, face me, and just keep your lips closed. All right. And now you're gonna follow these set of exercises. So I'm gonna demonstrate them and then you're gonna follow. So we're gonna start by rounding your lips like this. Like if you were to blow a kiss or make a bubble, okay? Okay, so now you're gonna draw your lips back like if you're smiling. And now we're gonna combine those two, going ooh-wee. Perfect. Okay, so now you're gonna puff your cheeks up like this. And I'm gonna use my mirror to make sure there's no marks of air. That's how we can tell if there's any air escaping. Very well. Thank you. And now I'm gonna touch inside your palate, inside the roof of your mouth, okay? Just to see, make sure everything feels the way it's supposed to. It might feel a little funny, okay? Very good. Thank you. Now I'm gonna check your tongue. So first, can you just open your mouth and let me see your tongue? All right, so now I'm gonna use my clean, unused tongue depressor, and I'm gonna use this to help me see between his teeth and his upper roof palate, his soft palate, hard palate, and all the other things. So we're gonna start, let me just see your tongue again, stick it out, perfect. And here's where we can use our flashlight. Right? So just take your time, okay? Now I'm gonna move into your molars. All right. And I'm gonna check your tonsils. Perfect. Thank you. So there I was able to see his hard palate, his soft palate, all his molars. I could tell that he got his wisdom teeth removed, and the height was good, the shape was good, and I'll notate all of that here. And now we're gonna try to do some tongue movements. So first you're gonna try to touch your nose. And now you're trying, like if you're trying to touch your jaw. And now move it to the side and to the other side. Perfect. And now you're gonna try to brush your hard palate with your tongue, kind of doing this movement. Perfect. All right. So now let me see you smile. All right. Let me see your teeth, the way they line up naturally, like if you're biting on something. Okay. And I'm gonna use this to just see the alignment of your teeth. All right. And now can you open your mouth, going like this? Okay, and close. Open again. Okay, and close. So I'm doing that just to check to see if there's any popping noise or any harsh opening and closing. And I will now give you a couple of exercises. So the first one, you're gonna say ah for me, ah, and close again, ah, okay, and close again and open, ah, all right. And now you're gonna make this noise, ooh, okay, one more time, ooh, perfect. And now we're gonna try to do these different noises with me. So the first one is gonna be pop. Okay, can you repeat after me? Pop.
Pop.
Perfect. Let me set the timer. Thank you. So we're gonna start the timer for 10 seconds and you're gonna repeat this noise as many times as you can. So pop, pop, pop.
Pop, pop.
Okay, so as many times as you can in 10 seconds. Are you ready?
Yes.
Go ahead and start.
Pop, 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 pop.
Very well. Now you're gonna do the noise ta. Ta, 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 ta.
Ta, ta, ta.
Okay, are you ready?
Yes.
Go ahead and start.
Ta, 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 ta.
Perfect. And now ka. Ka, 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 ka.
Ka, 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 ka.
Ready? And start.
Ka, 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 ka.
Very well. And now we're gonna put some of these noises together. So the first one is gonna be pa ta.
Pa ta.
Perfect. And you're gonna repeat that noise as many times as you can in 10 seconds.
Okay.
Are you ready? Go ahead.
Pa ta 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 pa ta.
Perfect. And now, last sound, you're gonna combine all three noises together. So you're gonna go pa ta ka.
Pa ta ka.
Perfect. As many times as you can in 10 seconds. Ready? And start.
Pa ta ka 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 pa.
Perfect. All right, so now we are just gonna go ahead and go through the list. We've checked your lips, everything looked normal. We've checked your tongue, everything looked normal. It was good size, good shape, good color, and you didn't have any problems moving and doing those different movements. And your jaw, I noted a little bit of a pop when you opened. Besides that, everything was well, and you do have a little bit of an overbite, which is normal and it doesn't affect your speech. And I did notice just a little bit of gaps between your front teeth, but nothing too big. So I made sure to note that. And there's no missing teeth. There's no missing. There's no decaying either. Your hard palate was of a good color, shape, and form. Your soft palate as well. I did see your tonsils that are in the right place, right size, and I did notice that you didn't have any breathing during your resting moments, and you were able to complete all the exercises, including the noises that we did. So thank you so much.
Thank you.